Hello everybody, my name is Laura Dale. I am working for LKV Baden-Württemberg and together with my all colleagues from HappyMu Consortium, we will try to present you MastiMIR.
Why we choose mastitis? Because mastitis is an inflammation which can be caused by more than 50 different organisms. And because mastitis produce a lot of problems, not just the losses of the milk volume, but also the currently, so a lot of somatic cells occur. Also, we can see that main components and also fine components are a little bit reacting to this mastitis. So we can see that lactose is decreasing while protein, fat lactose, sodium, lactoferrin, and beta hydroxybutyrate is increasing. Also, mastitis is producing a lot of economic losses. So from the total cost of all dairy cattle disease, 26% around 26% of the cost are due to the mastitis. Also, when a mastitis occurs, are normally the costs and the losses twice as high as infertility and reproductive disease. As it occurs, this economic loss due to mastitis it's not just the milk production reduced. It's also the milk have to be sometimes discarded, and also from time to time cows in the early lactation have to be replaced, and these are some costs for the farmers. Also, when the farmer wants to sell the cow due to the illness of mastitis, the cost for sale, the value of the cow is reduced. By having this warning system could help us to reduce the cost for drugs, veterinary services, and also laboratory. Regarding MastiMIR, I would like to point it out at LKV Baden-Württemberg in 2017 was developed the MastiMIR first model. We, together with our colleagues from Alsace, afterwards would discuss it in different projects. First of all in Elena and afterwards in HappyMu, how we could develop a model for Alsace and how we could work with this model in the production. So I will want to point it out in LKV Baden-Württemberg, there are spectral data from Bentley, and in Alsace there are spectra from Voss. In LKV Baden-Württemberg there are information from veterinary as data from health monitoring GEMON project, and in Alsace there are information based on observation from farmers. So what we have done validations models based on spectral data. So 30% of the data are in the validation. Farms validation, where 30% of the farms are in the validation, and third validation is the production year 2017-2018. So what we have done here, we have creating this model, and we can see that the model are working nice. For LKV Baden-Württemberg, I have to point it out that there are some filters for the somatic cells, less than 50% for the healthy data, and more than 400% for not healthy data. So I will say it like ill data. We can see that the model is based on filter, but when we do the third validation, it's not filter anymore. As you can see in the D4 dairy, we work also for the LKV Austria. In this project, we made this model just to compare with the model built from our colleagues from Boku University and to compare it. The colleague Lisa Rinzel made her master thesis, and she present this comparison forward for her thesis.
I would like to point it out that in Baden-Württemberg we create this new feature of MIR performing testing report. In this report we are presenting what MastiMIR prediction are saying as well. I just want to point it out that in whole Germany, field workers from whole side of the country, of the Baden-Württemberg, it's presenting and talking with the farmers about these reports. I just want as well to point out that these reports are not just in French language, they are also in German language. And by having this in German language, I just want to point it out it is possible also to be in another language. To underline what they will discuss, the most important is that they will discuss the first 5 or 6 animals that are presented here and see why these are in danger for MastiMIR. And as well, they will discuss why this animal have so many somatic cells. They will ask if the animal was already ill and because of the treatment, the MastiMIR is not seeing anymore, or it's about a problem of lameness. I would like to point it out that the somatic cell as well as the MastiMIR classes are going in the same direction. If we are seeing how many somatic cells are here occurring for each farm, we are seeing that the same amount of the MastiMIR classes is given. I want to point it out that around 131 acute mastitis were registered in the first 20 weeks of lactation and of the year, weeks in milk, and also that these subclinical mastitis were around 26. As well, the most important, the cholecystitis and chronic mastitis as well are registered. I would like just to point it out that here in the first build we have the mastitis classes by calendar weeks. As you can see here, there are from 1 to 20 calendar weeks, and normally in the start of the month we have more information that are registered, and as the month is finishing, the information are decreasing. Regarding the diagnosis distribution, the most important are from 21 to 29, which are regarding to the disease of the udder. If we are going more into approfundation, the veterinary diagnosis, for example, from, as I said before, 22 to 29 are the mastitis. The postpartum behavior are the 34. The 35 and 37 are endometritis and cycle disorders. And also we have some information regarding the dry period. I would like to point it out that for this type of diagnosis, which are based on mastitis, like 22 to 29 code sets, we look inside to see all these endangered classes, how many days between the diagnosis and also between the milk performance testing it's happening. As you can see, the most diagnoses are happening after the milk recording organization is coming. And I just want to point it out that we look also, okay, what's happening in the first 30 lactation days, if we have a lot of problems with mastitis or not. And as you can see it, all these codes here are showing that are some mastitis also in the start of the lactation, as also for the last period of lactation, so more than 245 days in milk, we are seeing that all these cows are in dry period. So after happening the milk recording, the cows were set dry because they are maybe giving birth or having also some problems with mastitis. If we are looking to the mastitis here in the 30 to 250 days milk, we are seeing that we can see very well 2 weeks into the 2 weeks what is happening. Of course, we can give with a better precision between plus minus 7 days, but it's possible also later. First of all, I would like to thank a lot to all my colleagues that helped me to develop this report based on MastiMIR, and also to point out that since May 2020 and February 21, in French and in Germany, we are using this report as a complementary tool for the somatic cells where farmers can control the herd in order to prevent mastitis disease. I think you already heard about this Daira Innov Congress. I just want to say, save the day and come with us. I would like to thank you for your attention, and thank you also to Interreg and all my colleagues from HappyMoo.